Hello, my name is Simona Cipriani. I'm here at the Art of Control, the Pilates studio in Stamford, Connecticut, and also the Center for the Art and Science of Contrology teacher training program. And today we're going to take a look at the roll up. The roll up is one of the most challenging exercises in Pilates, and so to start, we're going to break it down and teach it one step at a time, and then we're going to show you the full expression of that exercise. We're starting with what's called the roll back halfway, and Samantha's here to demonstrate that with you. And I wanted to just point out that because we want to help people and be supported at the beginning, we're going to use the straps for your feet so that you can really feel the pull in the opposite direction, and also the pillow on the other end so they will support the forward end of the head. In the roll up, our focus is to articulate and really disconnect one vertebra at a time on the movement of descent into the floor, into the mat, and to come back up. So when you are starting, make sure that your feet under the straps feel really in tension, so really secured. You also bend your knees so that you can facilitate the movement a little bit easier on the pelvis area. And you can also support your upper body by having your hands a little bit underneath your thighs. So Samantha is going to start initiating the movement by lifting into the core underneath the seat. So you'll see that she's engaging a little bit on the glutes and the abdominals. And the first movement that's going to occur is really in the middle of the spine, on the lumbar spine. And then she's going to roll slowly until the elbow is going to be straight. And then she's going to pull back in, up and over. So lengthening the spine as you go back. So focusing on lengthening, engaging the bottom, all into the arms is straight, and then pull yourself back forward. So maintaining a nice long capital letter C through the spine, and again. And then as you feel comfortable with this, you can actually come back a little further by sliding your hands down and really focus on imprinting the lumbar spine, and then rolling back up again. Good. And every time you lift at the beginning from underneath, feel like you're going from underneath the seat into the spine and going to the opposite direction. So your feet are pressing up, the tailbone is going toward your feet, the spine is elongating into the mat, and you articulating one bone at a time, and then you continue to go all the way down and rest your head. At this point, it feels nice to release, and so if you have worked a little bit too much on the shoulders, it's finally be able to relax a little bit. And then from there, we're going to reverse the action. Remember, in Pilates, we always learn how to be able to reverse the action, because if you don't know how to reverse it, that means you haven't really learned it really well. So once you perform in the opposite direction or reversing the action on the way back up, then you know your body knows what to do and how to articulate even when you have to come back forward. Okay, great. So you're going to now extend the arms in front of your body, keeping the arms parallel, and you're going to do the same thing rolling back. So you have no support on your hands. Sometimes the teacher will be here and giving a little bit resistance. So I'm trying to maintain my spine erect. And then she's really focusing on pulling me down with her, but now with the shoulder still rolling into this into the lower back first. Good. Then eventually I'm going to have her also take that away, the actual support of the feet away, to keep the challenging going. So I might be able to just keep her feet, flex at the beginning, and then she can just roll from there, rolling up, and extending the legs and doing a full roll up. So now she's really focusing on stretching a little more because the knees are extended. So go ahead and roll back bone by bone. So she's really pushing from from underneath the legs through the spine all the way up, pointing your toes long and taking the arms back up toward the ceiling. Good. So that will be a little bit more gradually getting further and further with the arms as well. Rolling up, chin to chest, lift the toes up, really focus on your navel going back as the arms reaches forward. Now feel the two opposite direction. So you have two parallel lines to go this way, legs going that way, and what you want to feel is that somebody else is going this way, pulling your lower back to the back wall, because you want to create a little bit of a space between the floating rib that it's right at the bottom of your rib cage and the pelvis bone, and you really want to make sure you keep that really lifted so you're not crunching in that area, because that could be a little bit dangerous there. But I also want to see the two opposite stretches. So the stretches over there with the legs and the spine are going to the opposite direction from the waistline. So we're going to take away the pillow, sorry. You're going to roll back down, Samantha. The next thing I like to do is give a little weighted pull. So you can use a 2 pound or 3 or 4. It depends what she can handle. And keep your fingers a little bit, and the wrist long. So everything is long here. And we're going to create a little frame at the level of the shoulders with the pull. So she's actually, relax your elbows a little bit more. Good. So you want to keep your elbows straight, but not completely locked, just like we do on the knees, right? So those two joints are straight but not locked. Now from here, you're going to lift your head up and focus on the exhale as you bring the arms, the body forward, and flex your feet all the way up to meet your feet with your hands. And keep that nice little scoop, and then exhale going back down. So every time you exhale the air out of your lungs, in Pilates, we want to deepen that exhale. You always want to think about going passing this place in the body, okay? So you go deeper as you exhale, as you taking the lower back off the mat. And here you finish your exhale and you deepen deeper your exhale. And then you inhale back again. And here again, you're going to go deeper into exhale so that you can facilitate that opening of the low back and also make sure that the bones separate. Now, the next level would be to really talk about the shoulder blades and the arms and what's happening in this area. So when the pull is a little bit heavy, she really gets a nice feel of plugging the shoulders into the mat. But every time she goes up with the head, it's going to come forward and it's going to go with her. And it's okay now to elevate your scapula. So I want you to feel that this is really stretching with the arm and really pulling the scapula up there. So if it's the shoulders are really close to your ears, it's okay to do. And then when you go back down, then you can just automatically descend with the scapula, and that there will be a little bit of depression, right? And then you can add it also when you take it all the way back above your head. And this is basically the most advanced level that we have in the roll up. And this is the, the full roll up, the full expression of the whole exercise. So the shoulders are elevated, right? They're really up high. Keep it nice and long and feel that stretch going all the way down to here into the rib cage, into the powerhouse. So you're going to come up. You're going to bring your shoulders back into the mat to really feel the nice connection. You roll up, flex your toes, and then reach forward with the arms, lengthen the arms and the legs in both directions, and then pull back with your lower back and lifting under the sacrum area, and then roll back again. And make sure that there's a nice rhythm in your scapula, lifting the shoulders up and reach above your head. So stretch in both directions. Feel the nice connection with the breath going ow, 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 ow. So when she's breathing out, the ribs go down. There's more connection here, but there's also more stretch all the way through the shoulder blades here. Okay, and Romano used to do this with us. My master teachers did this to make a little bit more fun. She always find a way to make it very fun and interesting. So from here, to give her more sense of curling your body inward and really getting the elongated C curve, she used to put a little pole there and said, now you're going to dance under the pole. So you're going to go under with your head and really, really, really very good, very, very close to your navel. So it's actually more like even a little closer to the body. And then do the same thing as you go back down. Don't touch the pole. Go under it, and go under it. Good. So that's to just emphasize a little curl. Like if you were a carpet, you want to think about rolling into yourself. So the breathing and the rolling up, it's very important. Thank you, Samantha. To really emphasize the full capacity of the lungs. So it's important to be able to have your rib cage and all the intercostal muscles to be able to really expand and to be able to really squeeze every time, and the arms going up and adding all the motion in the rib cage and the shoulder will also facilitate to loosen up all this area here. Sometimes it's really attached to the spine very rigidly, and so it doesn't allow the breath or the lungs to really expand. So it's a breathing exercise, besides also being, very, very important for the powerhouse, and it's also very nice for the spine to be able to be flexible in both directions.
Hello, my name is Dr. Joe Muscolino, and I'm here to talk about the mechanics of the second in the traditional mat Pilates exercise routine, and that is the roll-up. And we're going to break this into a few separate pieces. There are so many things happening together with the body that it's almost impossible to discuss them all at once, so we'll take them one at a time. So let's start with what's happening at the shoulder girdles. So Sam, go ahead and begin at the beginning of the position. And as Simona described it, we talk about plugging the shoulder girdles back down to the mat. And that's an isometric contraction of retractor musculature. We're talking about traps, especially middle trapezius and rhomboids. And that's really good for people who otherwise tend to round forward into what Yanda calls upper crossed syndrome. So that's the beginning position here. So then what do we do from here? Go ahead. Now she protracts. When she protracts, she can either do that from the pec minor, or she can do it from the serratus anterior, and actually the pec major can assist with that also. Usually we want more the serratus anterior to be the muscle that is involved for that protraction, because it keeps the scapula from winging away from the back body wall. And we can say more about that in just a moment. Now go ahead. Now here, as she goes back into full flexion, from a position of anatomic flexion, 180 degrees of flexion, we let the shoulder girdles elevate, which is good, because when you go into full flexion, by something called scapulo-humeral rhythm, we need to have upward rotation of the scapula occur, which is in part happening by elevation of the clavicle and scapula, and we would have some protraction away from the scapula being glued down, plugged down to the mat. And now you start to do the roll up, and she retracts back again, the shoulder girdles, and as she reaches forward, she starts to reach forward with her shoulder girdles, and she's both elevating and she's protracting the shoulder girdles here. And that's going to be contracting perhaps pec minor, pec major, serratus anterior. And now we can see if she's dominant, with either, let's say, pec minor or serratus anterior. When you see winging of the scapula, where the medial border of the scapula wings away, that's usually a client who's pec minor dominant. And if we see that, then what we can ask her to do is not to reach as far forward. You know, in Pilates, it's always said it's not how many, it's how. It's not how far you go, it's how. We don't want to imprint a poor postural pattern. So we don't ask her to go farther than she can control the proper posture here. The other thing we can do is we can tap on the area of the serratus anterior, which if she protracts from serratus anterior, that will hug the scapula against the rib cage wall and prevent that winging or tilting away, or what's called medial rotation of the scapula. So we both make sure that she doesn't go too far, and we try to cue by tapping over the serratus anterior. So she has that elevation, the upward rotation, and some protraction of the scapula here. Now you go back, and as she goes back, she's starting to retract the scapula, going down, 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 down. She really retracts now, plugging down into the mat, and then she goes back to protraction, and then full flexion here. And we're back to where we began there. Okay, so now let's take a look at the curve of the spine. So go ahead now and start to do the curve here. And as Simona brought out, as she goes into flexion here, we do not want, let's make this an exaggerated unhealthy, we do not want a collapse into flexion with a big hard C position here. We want a gentle C, like a gentle crescent shape. Because what we're looking to do is we're looking to have flexion, but with elongation. So the pelvis is posteriorly tilted. The lumbar spine, which is normally a curve of lordosis, a curve of extension, is now hypolordotic or gently lordotic, gently into flexion, and we keep a gentle curve of flexion in the thoracic spine. A nice, smooth, gentle C the whole way here. So we're elongating by not letting too much flexion in thoracic, by decreasing the lordotic extension in the lumbar, and that's facilitated by the posterior tilt of the pelvis. Now, as she goes forward there, she's also told to dorsiflex her feet at the ankle joints. And what that's doing, and are you comfortable resting there for a second? Yeah, rest there for a moment. What we are now doing here is putting a stretch on the entire posterior side of the body. The head and neck are in a gentle amount of flexion, gentle flexion thoracic, actual decreased extension or flexion of the lumbar spine, posterior tilt, and when the feet are brought back into dorsiflexion, that not only stretches the plantar flexors musculature in the posterior leg, gastrocnemius soleus, but by their connection myofascially, they also connect into the hamstrings, which are also being stretched anyway by full knee extension and by hip joint flexion. And in fact, we now see that we have something called the superficial back line myofascial meridian anatomy train by Tom Myers, and that is the plantar fascia going into the Achilles calcaneal tendon, into the gastrocnemius, into the hamstrings, attaching into the ischial tuberosity, the sits bone, going into the sacrotuberous ligament, into the sacrum, and then by the thoracodorsal, thoracolumbar fascia, into the paraspinal muscles, all the way up the neck to the head, into the epicranius, the occipitalis, scalea aponeurotica, and frontalis muscle. It's one long continuity of myofascial tissue, the superficial backline anatomy train by Tom Myers. Okay, so let's have you go back down. Okay, and you can rest for a moment. So we've covered the shoulder girdle posture. We've covered the gentle C curve of the spine. We've covered the entire rounding in back. So now let's take a look at a couple of additions. So I'm going to give you this. Now when Simona stepped in here and she gave some resistance to Sam, so come on up a little bit because you were up here, and then Simona said, I can even give you some resistance. So now she's working to go back, and as she's working, let's look at what she's working. She's trying, come on back up for a second. She's trying to posteriorly tilt her pelvis, and you can rest here. And to posteriorly tilt her pelvis, she has to use the anterior abdominal wall muscles, and she has to use the glutes. So by me giving resistance, go ahead, I'm increasing the contraction strength engagement of the anterior abdominal wall and the glutes. Also, come on back up again. Take a look at her thoracic region. Go back down. She's gradually going from a flexed position to a less flexed position, meaning she's extending a bit, meaning she's using I can take this from you, she's using the paraspinal erector spinae transversospinalis musculature of the thoracic spine, which again is so important to strengthen that to keep us from falling into that upper crossed rounded posture that gravity tends to pull us towards. Now one more additional thing, we can be using the straps. So if we put your feet in the straps, you can just slip down a little if you need to. Are you comfortable there? Good? Okay, so now with the straps, the big idea is the straps are going to take some of the work of the lower extremity musculature away from them. So for a deconditioned client, they get a little help there, because in the end, what she needs to do as she lifts up is she needs to stabilize her pelvis. So here's the circumstance. As you start to round up, go ahead and round up, she is contracting anterior abdominal wall musculature. All anterior abdominal wall musculature, and once you go to a resting posture, you can just hold there. All anterior abdominal wall musculature is also posterior tilt musculature of the pelvis. And we want a posterior tilt, but we don't want an exaggerated posterior tilt. So come on back down and do the roll up. Once you get down there, do the roll up. So what would happen if she doesn't stabilize the pelvis going up is the pelvis would drop way too far like that, and we'd see the thighs lift off the mat. So by having the thighs stabilized down with the strap, she can keep the thighs down and prevent too much collapse of the pelvis into posterior tilt. As she gets stronger, of course, she will be holding those thighs down against the table with her glutes, which do extension of the thighs at the hip joint to hold them down. And there'll also be some contraction of hip flexors to oppose the anterior abdominal wall posterior tilters, because hip flexors are anterior tilters and they would stabilize the pelvis from excessive posterior tilt. You can go on down. So we see that there are a lot of pieces to this exercise, and a lot of muscle groups are co-contracting in a spatial and temporal pattern to have fluidity, to have a coordinated movement pattern. There's only one thing left I'd like to discuss here, and that is the idea that Simona talks about maybe even touching and cueing one vertebra at a time. So this is supposed to be also an articulation exercise. And if someone comes in and they already have this flexibility, then we can really ask for that flexibility, that when she flexes up, go ahead, she might flex the head at the atlanto-occipital and then C1 on 2 and 2 on 3, etc. She gets in the thoracic and she flexes T2 on T3, T3 on T4. She goes down into lumbar, and it's one vertebral level at a time as she goes up, and then she extends and articulates one vertebral level at a time as she goes back down to the mat.